Dr. Patel, what's going on, bruv?
Darren, here we go.
I heard, we met, was it 2 summers ago? It was 2 summers ago, I
One
think.
oh, when we met
Yeah, when we did the podcast, you, me, and
one
Smith.
summer ago.
Was that
That was
last
last
year?
year, yeah.
Really?
Yeah.
I'm getting shit confused, man. Well, you
But
called me and said Smith's podcast was awful. He didn't let me speak. You seem like a much nicer guy. Can we do a podcast?
and that's how I find myself here in this intimate
Intimate
space.
space. How you been?
I've been good. Since last time I saw you, lots has happened. Of course, I'm still at the clinic seeing patients day to day,
Yeah.
but a lot of talk about turkey teeth, a lot of talk about all the subjects we mentioned. And I guess we'll come to it, but I've had a lot of conversations with people, dentists, about that subject because people watch that podcast.
Really?
Yeah, it's been interesting.
So why are you trying to take my cousin's businesses, bro?
We'll
we'll get to that. We'll
get
get
to
to
that.
that.
We'll get to that.
We'll get to that.
I think you'll like my answer. We'll get to it. You'll like my
I
answer.
think I
Yeah.
think I will as well because I think you're a decent guy, bruv, and I think you want to help people and you want to give like the right answers to people because I know you work with integrity and I know you love what you do. So, and lately you've been smashing it on socials, right? I've seen you posting more stuff and educating people on um is it oral health?
I,
Is that what you'd call it? As in, because I wouldn't say you're a dentist.
hmm,
You're a cosmetic
dentist.
dentist, correct?
I'd say
Okay,
so.
good.
Yeah.
Okay, cool. Oh, I
Yeah.
didn't want to get that wrong.
Oral health, dental health. I guess oral health is a technical term.
Yeah,
Dental health or
dental
mouth
health.
health. I try and put out answers to questions people are not able to get because their dental appointment is too short,
Okay,
or questions that I get asked all the time outside of the clinic. Someone just kind of
okay.
takes you to the side when you're in a social setting and says, "I just have one question I need to ask you."
Yeah.
I try and put that all out so people can just get to it and
Yeah, because there
out of
must
there.
be so many probably very basic questions to you and basic answers.
I wouldn't call them basic actually. Even to the point where dentists debate the correct answers, but they're questions which are really valid and things you wouldn't think about. Even when it comes down to what to do first. Do you floss first? Do you brush first? Is there a difference? Is it worth even thinking about?
I
And
think
it's a good question.
that is actually a good question.
Yeah, you brush before or after breakfast, right? All these things we
Yeah.
don't think about it in the day, but I get asked them all the time. What's the market rate for a tooth fairy if your child loses a tooth?
Shut
How
up.
much should I be putting under the pillow? I get asked that by
What?
parents. Yeah,
Really?
they want to know what other parents are doing so they can match that accordingly. So they ask me.
Do you feel like because you're a doctor, yeah? Do you just feel? I'm not gonna say. I know you don't feel better than people, but do people talk to you different? Do they talk to you different?
I would like to think no, because I try not to come across uh, like someone who's in a separate space to a layperson.
Yeah.
I try and be as normal, whatever we define that as,
Yeah.
um, because you think of a doctor, a dentist, or a vet in a certain category, a certain archetype of person.
Yeah.
I'm not trying to get away from that, but I think I try and show the kind of humanity and the fact that we were all non-dental once upon a time,
Mm,
and that character and personality is exactly the same now. I'm a dentist,
yeah.
so I behave the same to people as I would, but I just have a different set of skills and knowledge now.
Yeah. Okay.
To answer your question, are people speaking to me in a different way? I guess I can't truthfully answer because they're already speaking to me. I don't know if they
Yeah.
would speak
Fair
differently.
enough.
Social settings, I don't think so. I think about the same. The only difference I would say is they might ask a dental question at some point in the night.
Okay. Feel you. What would you define as normal?
I know what you're going to ask that. Society will dictate what normal is based on how times are changing,
Okay.
right? Normal now is a bit different to normal 20 years ago. And for example, what is considered politically correct, what's considered polite or offensive now
Mm,
is different
yeah.
back in the day. Relevance to dentistry and medicine, not a huge amount unless you get into kind of transgender type conversations,
Mm,
but things change. And normal now is going to be normal different in 10 years, right?
10 years.
So we're shooting for a moving target.
Yeah. Maybe even a day. Depends who you talk to.
Yeah.
right? I mean, things and people are changing on a daily basis, especially now. Things are moving so fast. How old are you again? How old are you?
How do I look? Oh, we've done this, but
Have we done
it's been
this?
2 summers, but, you know.
I remember you like my age, like 31,
Yeah,
32. You're 31, right?
yeah.
Yes, I remember.
Oh, we're the same age.
We're the same age,
Yeah,
1992,
there we go.
right?
Yeah.
Yeah, 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 yeah. Good genetics, bruv. You got good genetics. You're like the most handsome dentist I've ever seen, bruv.
Oh, thanks,
Do you
that's
get
kind.
that a lot?
Um,
You must get a lot of patients hitting on you, man.
well, I, try to, keep it professional as much as one can.
Yeah.
So occasionally,
Okay.
but I think I'm there to help their dental health as a priority. So it's kind of it's not going to be in my mind at that point. So
Yeah. Okay. Fair enough. Question for you. Um, can you tell a lot about someone when you look in them, when you look, not in their mouth, but when you look at their mouth?
mm.
Because I don't know about you, yeah, but sometimes I look at people and the way their mouth moves and their teeth, I can, I'm like,
What can you tell about them? Better
honestly,
question. Yeah,
I don't trust people that have like, I can normally, it's really hard to explain. Okay, I'm gonna try to explain this the
yeah.
best way possible. Sometimes the way people's mouths move, right? Let's put the fact that they don't look after their teeth, right? Can usually tell me that they're individuals that don't potentially look after themselves. All right. That's the first thing that I would say. The second thing that I would say is that sometimes the way people move their mouths, it just dictates if I trust them or not. And I don't even know how to put a word on it. When you look at someone's face, their energy and the way they move, their body language, I think it's quite obvious what sort of person they're if you pay attention, whether it's someone that is anxious, whether it's someone that is looking for an opportunity or to be sneaky, to, I don't know. It's really hard to explain.
You're
And I've
talking
got in trouble about this as well
you're talking about body language on a micro level
on a
on their
micro
face.
level on their
Yeah,
face.
I think you're probably onto something. It's hard to articulate it into words what you're
Yeah.
referring to when it comes to like mouth movements, but you're talking about facial expression, right?
Yeah.
You're taking extrapolations from what you see on their face into their personality,
Yes.
and kind of circling back to teeth. Everything you said about how someone looks after their teeth might reflect on their overall body is true, and not from a necessarily an opinion point of view. They've actually done studies on what we perceive as humans on teeth or when we see someone's teeth and smile. And they noticed that people with a straight set of teeth, we would associate that with a more orderly, organized person, a more intelligent person, a higher IQ. It doesn't come into our mind actively, but subconsciously. And then someone with, let's say, crooked teeth, crowded teeth, we might associate that with someone who breaks rules,
Interesting.
creativity, quirky. These personality traits come into the shape of the teeth, the position of the teeth. We do it without thinking. And that can also come into, how you dress your hair, how you dress, if you have a beard, the style of
Yeah.
that.
Yeah.
It
Yeah.
all kind of comes into the kind of cosmetic appearance of someone. So I think what you said is reasonable, but you've identified that you're actually seeing this. I think everyone's doing it.
Yeah. But maybe not paying too much attention to
Yeah.
it.
You've analyzed it and kind of you've become self-aware.
I think sometimes I overanalyze things. I'm like,
Mm.
I almost like, if I see something, I almost protect myself in a way of like, I'm not even going to go there because I just know what's going to happen. And sometimes I can misjudge it. I'll be honest, I'm quite good with it. I would say I'm quite good with it. And I think that's because of like my parents. They were like that. They kind of had to be like that when they didn't speak the language. They have
Okay.
to rely on that more.
Yeah.
Right. So I know I've seen it through them. So I kind of put both together in a way with like how I do things now in a
Okay.
way. But when you're talking about like teeth, you said sometimes it says people are creative, more organized.
Mm.
How does that dictate what shape your teeth is? How does that dictate that? Is it,
How in terms of biology?
yeah, like how does it dictate that? How do you know, like, what does that? What creates that? What puts your teeth in that shape?
Is it nurture or nature? Right. Let's say someone's got really oval shaped teeth, really soft edges. Your teeth are relatively hard edged in that they're straight, quite square. If I remember from last time,
Okay,
right, which is
yeah,
a relatively masculine way of teeth developing.
interesting.
Softer edges are considered more feminine. So what comes first? Have you somehow influenced that through your teenage years and how you've used your teeth and made them squarer, or has it developed through genetics and upbringing? I don't have the answer.
Okay.
No one has the answer to that.
No one has the answer to that.
No, I don't think so. I don't think we know enough about it. Development of teeth is going to be genetic in a lot of ways. So you look
Yeah.
at your parents' teeth, you can take away some of their risk factors, but also shapes of their teeth would
Yeah.
probably be a combination of mum and dad,
Okay.
and the personality elements. That's probably humans thinking too much into the shapes of teeth.
Okay.
But I think it does hold water to some degree. For if someone's got crooked teeth, doesn't mean they're going to be a creative person.
Okay.
Doesn't mean they're a disorganized person.
Yeah. Yeah. Yeah.
They could just have crooked teeth for another reason. They suck their thumb or something like that.
Yeah. Yeah.
There are lots of factors involved. The relevance of it is when you're trying to change something. If you come to a cosmetic consultation and you want to look a certain way or change things, we would look at that and think, do we want to give you square edges? Do we want to go really uniform and really straight and aggressive? Or should we make it softer? And that's something I discuss with people. So that would be the practical relevance.
Who dictates that? Do they turn around and because I'm sure you get people that come and go, I want this, I want to look like this. Because I've seen some awful fucking work.
Yeah.
And I look at people and I'm like, big man, like, go get your teeth done. And this goes for anyone doing whatever.
You tell them.
No, when I look, no, no, well, I tell my friend next to him. If I
Okay.
chat to them, if it's my mate, I will 100% banter them.
What did you say to James when he had his?
Well, I said, your mouth looks different.
Okay.
I said,
Okay.
your mouth looks
Is that a
different.
compliment coming from you?
F- to be honest, like we don't really compliment each other like that. We give each other shit a lot.
Fine.
It's with our
Okay.
friends. So
Yeah, yeah.
I'm always like, what I did notice though when he did get it done is he used to talk to me about his teeth, right?
Mm,
I never used to pay attention.
of course.
I never used to pay attention because I was like, like whatever. But like, I never used to pay attention to my teeth. But I've got comments before from people going, "Oh, Dylan, you've got a good set of teeth." I actually didn't know it was a big deal, and I think that's because I was genetically lucky.
You've looked after yourself as well. Both.
Maybe I guess so.
Definitely.
But no, you want to hear this, bro? I don't know. Maybe I said this in the last. Maybe we spoke about this before, but I don't know. I basically
What have you done?
what I didn't do was I didn't go to a dentist for like 7, 8 years.
Yeah.
I didn't know I had to. I know this sounds stupid, yeah, but like my culture, my background, they don't do them things, right? they don't have the money to do that, right? So I was traveling a lot. I was living in Australia for 4 years, 5 years. Didn't have like I was one of those guys that, where's your local GP? I was like, I don't have one. I don't
Okay.
have a local dentist. I'm everywhere, sort of thing. And then in Bali, my gums were killing me. They were killing me. My teeth were hurting. And I was telling Smith, we were living in a hostel together, me and him, like not sharing a bed, but like two single beds in a tiny room. And I was like, oh, it must be the water here. It must be the alcohol we're drinking. I must be stressed, all this fucking shit.
Okay.
Smith was like, when's the last time you went to a dentist? I was like, don't know, like 6 years ago or something, bro. Something like that. He was like, mate, go get your gums looked at.
Yeah.
And then I went to the most booky place in Canggu in Bali, thinking, "Oh, I'm definitely going to fucking catch something here." But I walked out with all of my pain gone. She literally,
What do they do?
mate, they cleaned my
They
mouth.
cleaned your teeth. Okay.
But I've never felt my mouth relaxed like that in my life. And she was like, you had so much, what do you call it?
Plaque.
Plaque.
Calculus. Yeah.
She had it all in a thing and she shaked it and it was like, shh, and I was like, oh my fucking God. I was like, how often? She was like, you need to be going every 6 months. I'm like, oh shit. Since that day, every 6 months, I'm there clean, getting myself sorted.
Okay.
Every 6 months, yeah. I've been looking after it more.
Well, that kind dentist in Bali changed your approach, right?
100%. But then I was thinking, I must be quite genetically blessed that I didn't have those issues.
Mm.
Now, how much does genetics play a part in how healthy our teeth are, like compared to how you look after it? So, for example, if my genetics are ridiculously good, like teeth, and I don't look after it, and I can still get away with it for a long time compared to someone that's not really blessed and they have to look after it. Does it play a big part?
Good question. There are two parts to this: your question, and then the 6 months and
Yeah,
6, 7 years part. Genetics plays a significant part in development of gum disease.
Okay.
Gum disease being when the bone structures around the teeth start to recede. Teeth become wobbly, you lose teeth.
Okay.
Certain certain racial groups are more susceptible to it than others. So the whole Asian subcontinent is more susceptible to gum disease as a race. So that group of people, me included in that, would need to have a better average brushing level and contact with a dentist to avoid the same amount of gum disease for someone like yourself.
Okay.
So local factors as well will help or not help you. So your mum and dad, I would assume both of them have got their teeth, right? Have they
Yeah.
lost their teeth?
My dad needs to definitely look after it a little bit better recently,
Hmm.
but majority of their life, they never
They've
had
been
to.
okay. Yeah.
Yeah, they're fine though, yeah.
So certain genetic lines will have a gum disease strain running through it. And the test is, do any of your parents have, or grandparents have early loss of many of their teeth? And in your case,
Oh,
your mum and dad
no.
don't have that. So you could say that you don't have that genetic predisposition, which makes
Okay.
sense given you had this 6 to 7 year lapse and you didn't develop gum disease. As far as it sounds, you just needed a really good clean.
Yeah.
When it comes to tooth decay and other issues, there isn't a evidence backed opinion on whether you can have weaker teeth as a result of genetics. But colleagues, dentists I speak to, anecdotally, we find that there is a difference between certain people in how hard their teeth are. We only notice that when we are using our instruments on them. Some feel softer, some feel harder. We don't know why. It could be your diet or an illness as a child in development of the enamel and the teeth develop at a really young age from when you're in the womb all the way up until 2 to 3 years old. If you have a disruption at that time, it could cause the issue. So it might not be genetics; it could be local, like antibiotics or an illness, that sort
Okay.
of thing, or even during pregnancy, your mother could have a poor diet or an illness, and that can affect your development.
Oh, shit.
Dentists don't really know. So the main one is gum disease.
Okay.
Coming back to when to see a dentist,
Yeah.
you mentioned 6 to 7 years being a long time. It is a long time, and we would always advise someone to see a dentist as opposed to never seeing a dentist.
Yeah.
But I've had lots of conversations since last year about how often should we be seeing a dentist. In the UK, 6 months is the kind of blanket rule for everyone, and it is too much on the whole. And the caveat with that is it needs to be risk assessed, meaning someone like yourself who's relatively low risk on the face of it wouldn't need to see a dentist as much to maintain the same level of health as someone who is genetically susceptible and needs to have a lot of contact with a dentist. 6 months for high risk people.
Okay.
And that's all supported by our clinical guidelines. So many of my patients are on 12 months, and people who are really low risk, for example, never had a filling in their life, look after themselves really well. You can go up to 2 years or more.
Oh, really?
Yeah.
Okay.
Dentists tend not to say that. I don't know why.
Well, probably because they get him in more often, isn't it?
Maybe there's an element of that. But then in the current climate, I don't know if you've heard, there's a massive shortage of dentists.
Oh, is there? I
The
didn't know.
NHS, our national health system, is sort of buckling at the seams, and reason for it is there aren't enough nurses and dentists to supply the demand of the population, and especially in the north of the country, it's really strained.
Really?
Yeah, so that would always support seeing a dentist no more than is necessary to maintain health.
Mm.
That would make sense, not a blanket rule of 6 months. It's got to be risk assessed for the individual.
Okay. Interesting.
That's one of the messages I've tried to get across, and it's not quite computing with everyone. I'm
Y-
talking about dentists
yeah.
because everyone's so used to 6 months. That's
Yeah.
the way, and that's the way.
I feel like there's a few things with that. I feel like there's um that every 6 months, brush your teeth twice a day, mouthwash this, don't use mouthwash.
Yeah.
Like you get a bit confused. Like, I'll be honest, I don't brush my teeth twice a day, man. I brush it once. I feel like dentists, I don't know, you tell me. Am I doing it right? Am I doing it wrong?
Well, for the benefit of everyone listening, tell us what you do exactly.
Okay. All right.
I know
So
it's once a day, but what about around it? What walk into the bathroom,
yeah,
end of this evening. What do you do?
I'll floss.
Okay,
I'll floss. But then I'm like,
front to back. All the teeth.
Yeah, all of it, like in
Okay.
between, in
You must
between.
have pretty good hands then. It's quite hard to do.
I've got like 3 different, little, what do you call it? I don't know what they're called.
Interdental brushes?
Yeah, I've
Yeah.
got 3 different ones.
Good.
I've got ones for my back teeth,
Yeah.
I've got ones for the lower ones here, and then
Okay.
ones for the top.
Cool.
Um,
Okay.
you
You do
should
that first on all the teeth, and then?
I'll do that first,
Yeah.
and then I brush my teeth with my Philips, is it Philips? Yeah,
Yeah.
Philips machine.
And do you wet it, then put the toothpaste on, or do you put the toothpaste on, go straight in?
I wet it and then put the toothpaste on just a
Okay.
little bit,
Yeah.
make it all moist. And then I clean it.
Yeah.
Um,
Where do you start?
I start like here.
Front tooth.
I
Yeah.
start front, and then
Okay.
I clear one side first,
Yeah.
then I clear the other,
Yeah.
but then I put half the brush on the gum, half the brush on the tooth.
Okay.
I've done my research, bruv.
Nice.
Yeah. And I do that all the way around, and I won't lie, then I do the inside, but the inside is long, man.
Because you can't see it.
I get ticklish.
Okay.
Yeah, I can't do it. But
Are you
then
brushing your palate or are you brushing?
I don't know. I'm trying. Sometimes I'm like, oh my God, I can't get in there, bruv.
Okay.
But like when I'm doing it, I'm like, don't get me wrong. There's times, majority of the time, I'll do twice a day. But there's a lot
Yeah.
of times, if I won't lie, if I'm dead and I'm like,
Yeah.
I fell asleep on the couch or something, I'm like, fuck this, bruv. I'm going straight to bed, man. And then I heard like one dentist saying I don't have to do it twice a day. So I'm like, I'm taking that advice.
Which dentist was that?
I don't remember. Was that you?
Possibly.
I
Yeah.
think it was you,
Possibly
know.
was last
It
year.
might have been you. Yeah, it
Yeah.
might have been you. It might have been you. So I was like, no, I remember that. And that's my excuse. And that's my excuse.
It's, I like what you're doing actually. I think it's
Okay.
quite a good routine. There are a few things I could kind of tweak, but coming right back to it, once a day versus twice a day. The evidence base supports brushing once every other day to maintain health in those who are not genetically susceptible to gum disease.
Wait, one what?
Once every other day. That's the evidence base. But that is if you're not susceptible and doing a perfect brush.
Okay.
Prevailing guidance from dentists across the world is 2 minutes twice a day. The reason for that is because we need to over egg it a bit so that people get to a point where
Got
they're
you.
healthy, because that's the priority here. And it's not so much that it's going to be overbrushing. So 2 minutes twice a day is what I'd recommend. But once a day is more common than we think, right? People don't admit it. So
Yeah.
I'm glad you did. If you're going to miss one of the brushes, miss the morning one, not the evening. And it sounds like from what you said about being on the couch, it might be the evening one that you miss occasionally.
Yeah.
Yeah. The reason for not missing the evening one is because the salivary flow in your mouth reduces big time when you sleep. So any issues from what you've drunk or eaten that evening
Okay.
would stay between the teeth and fester, cause a bigger problem. Whereas in the
Mm,
morning, you go about your day, you might have a drink of water and it'll be okay.
okay. Interesting. So don't miss the evening one.
Yeah.
Okay. All right.
Keep
Cool.
the evening one as much as you can. And from your routine, I like what you do. Interdental brushes first and floss. Interdental brushes are the soft bristle brush that have different sizes, color codes that
Yeah.
you've been taught to use.
Yeah.
They're superior to floss, so keep using those. Doing it before you brush is a good idea.
Okay.
You don't need to wet the toothbrush before you put the toothpaste on.
Okay.
The toothpaste manufacturers have gone through lots of effort and years of research and development to put the right amount of moisture into the toothpaste. So it's already set as soon as you squeeze it out the tube. If you wet it, it dilutes it,
Interesting.
makes it foam up faster, makes it runnier faster, you spit out sooner.
That is true, actually.
Yeah.
That's not-
Other
yeah.
than that, I would say instead of starting on the front teeth, start at the back, or start on
Okay.
the inside at the back, the part that's hardest to clean, start with that. If you get to the hardest part at the end of your brushing cycle, you're more likely to stop, put it down.
So okay. So if people were to start brushing their teeth properly, should they focus more on quality every day instead of more volume of brushing their teeth?
Absolutely. Quality.
Quality.
I would rather someone does once a day a perfect brush than twice a day slapdash,
Okay.
because you're going to access all those areas. Problems start when we miss certain areas, because we miss that same area every time we brush. Then it festers into a problem. That's why dentists come in and actually check those areas. So quality over quantity, definitely. The other thing is people in the fitness industry will generally be quite strong people, I would think, stronger than most. You're doing weights and things. As a result, we tend to hold a toothbrush with a fist, hold it really hard, push it really hard. And if you're not feeling that clean feeling on the gum, you think you're not doing a good job. That's not the case. You shouldn't feel like you've had a scrub against the teeth. That's too much. if the bristles splay on the tooth, it's not doing a good job. So keeping the bristles straight against the teeth and a very light touch is the best way.
Okay. All right. Yeah. That was definitely me. I was that guy like,
Yeah,
I
especially
was,
if you're in a hurry, right?
oh yeah, 100%. That was definitely me. I don't do that anymore. I don't do that anymore. And I actually try and take my time with it. Before I used to be like, okay, just quickly get this over and done with. But now I'm like, I almost get into this like meditation mode, like just boom, just take your time with it, take your time with it. But whatever I do, it's never going to be as a clean cleanup like I would get in a dentist, right?
That's right. The instruments we use in the dentist are much finer. They, if you probably remember, it's a whizzing noise,
Yeah,
lots
yeah,
of
yeah.
water, and what it is an ultrasonic frequency against the tooth, and it removes very stubborn areas of plaque which won't get removed with a toothbrush.
Okay,
So it helps in certain areas. 'Cause toothbrushes are great, but they don't get everywhere.
okay,
They probably hit about 90% of spots.
okay. And
The remaining 10, the dentist or the hygienist will pick those up.
so what would be say if someone doesn't know if they got potential gum disease and they
Mm,
haven't gone to the dentist, I haven't gone in over 7, 8 months, what would be the signs of what
issues,
issues where you should be like, okay, well, you should go see one?
bad breath.
Really?
There's a particular type of bad breath which dentists can smell. It's a particular thing which so they say there's a running joke that people make in that you can diagnose gum disease before they've even sat into the chair
Sharp.
because you can smell it as soon as they've spoken to you.
No way.
And that is true to an extent. Once you've seen enough people with the same gum disease smell, you can understand what it smells
What
like.
does it smell like?
It's hard to describe, but it's not like a morning stale bad breath that you might be thinking of.
Is it just like smells like death?
Sm- Smells pretty bad, but something you don't really forget
Okay.
because it's quite unique. You don't get that smell. There's no comparison
Okay,
of
got you,
something
got you.
similar.
So when you know, you're like, yep, that's it.
Yeah, and it's nothing kind of related to the smells of food and drink, so you can't really associate it with anything.
Okay.
So that's the biggest one, and the people who have it will not notice it on themselves, of course, and the people around them might not notice it. They might just say you got bad breath. So that's the first one.
Okay. So that's like people like with BO in it that they don't realize.
Exactly right. Same thing, same thing.
You have to pull them aside, be like, brother, listen, I don't.
I would say that that's a kind person.
Yeah, I've done
That's
that.
it.
I've done that. I'd had to do that at work one time.
That's a friend in need.
Yeah, yeah, yeah.
You've done that?
I've done that at work one
Yeah,
time. I was
it's
working in JD Sports years ago. I was like 17 years old,
yeah.
and I pulled a guy aside. I was like, bro, like, go get some deodorant, bruv.
Was that hard to it must have been hard to say, right?
I'm not gonna lie, I was looking forward to it. I thought it was quite funny. I thought it was quite funny because back in the day, like I was just like where I was from, it was just like people just say shit like that, but they say it loud. Hey, Darren, man, you stink, bruv, or something like that. So
Okay,
for me, it was like it wasn't really a problem, especially
maybe it's
it was
easier.
alone. I did it 1-to-1, so it wasn't an issue.
Okay.
If he took it the wrong way, then I would be like, bro, I'm doing you a fucking favor, bruv. Are you stupid? Like,
Mm.
relax.
But
But
also you say you're 17.
yeah, I was
So
17.
at that age, I mean, I think,
No one
yeah,
cares.
you can kind of say what you
You
want
say what you want.
anyway.
Yeah, exactly.
Imagine if it was in a workplace on a PT floor or one of your clients. Oh, tough, much
Oh,
tougher, right?
clients is
It'd be hard.
actually it's a
It'd be
hard one,
difficult.
especially when
Imagine
they're
you have,
paying you.
yeah, long-standing clients. How do you manage that? It's tough.
It is tough.
Most people probably wouldn't say a thing.
Yeah, it's
It's
true.
you just said it's not really your bag. It's not your field,
Yeah,
right?
yeah,
You're kind of overstepping the mark.
a little bit.
Yeah,
But I think
but
it has to be said
it
though.
does. It
There's a way
does.
you can deliver it.
I think. I don't know who's gonna phrase that correctly. Um,
I'd grab them. I'd grab them. I'd be like, hey, listen, yeah,
how do you say it?
you know how much I like you, right?
Yeah.
You look into my eyes. You promise you're not going to get offended if I say something. They go, no, 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 no. Okay, get some fucking deodorant. And then laugh, like in a way that's not uncomfortable.
You've done like a good and a negative, then a good
Yeah, yeah.
laugh at the end.
Because I feel like when you make something, in anything in general, when you make it, if you put too much pressure on whatever that thing is, like too much attention to that, the energy you bring can create like a real negative space.
Mm.
Whereas if one of your boys have like messed up or something's happened and you've addressed it, like, hey, listen, I know I've just come to your house my first time. I won't lie to you. Don't go into your bathroom. I've took a shit in there, mate. I'm sorry. tell your missus I'm sorry, but I couldn't help it. And they're like, it's like almost you, they can't even get angry
Yeah.
because they're like, oh, fuck, he's just been so straightforward with it or whatever.
But
Do
I
you know
think
what I
you're
mean?
right. It's more powerful in the fact that you've said it in a way that's sincere, but you haven't made the person feel awful about it. As
Yes.
a result, they might respond and actually comply, getting what you want and something better for them as well.
Yeah. 100%.
And that happens in healthcare as well. But I mean, unfortunately, not many have taken your approach, which is a bit of a shame. You know, we don't get taught this in medical school, how to deliver advice.
Mm,
It's very didactic and paternalistic.
okay. So they don't exactly teach you how to communicate properly, I guess.
They do, but not in on the lines that we're talking about. More on the lines of being empathetic to someone's pain, because pain is pretty commonplace in medical and dental.
Of course. Yeah.
Someone's
Yeah.
presenting with pain, so it's quite a complex emotion to go
It
through,
is. Yeah.
and it can make you react in all sorts of ways. So that's a common kind of focus. But delivering advice in a way that, or trying to change someone's behavior,
It's a,
it's tough.
it's tougher for you guys.
And we're in a position of knowledge and skill,
Yeah.
and we're trying to deliver something in a way that doesn't alienate them, doesn't make them feel small, and doesn't confuse them because
Mm,
technical jargon is not helping anyone.
yeah.
How did you do that? My opinion is take a complex idea, simplify it into terms that everyone can understand. And I think, like you said, deliver it in a way which is a positive, even if someone is completely wrecking their teeth, which
Yeah.
I've seen all the time. I never really say that to them. They're usually aware of it, or I try and bring them around to realizing it. But we start with what they're doing well. The fact that they're in the chair today, they've made that step to move from home, go to see a dentist. That's a positive step. Then from there, you build, give them a small piece of advice, see if they take it on, and then build it from there.
Okay. Yeah.
You don't bombard them. They don't feel like they're, in a medical, they're already nervous because they're in a medical area.
Yeah.
It's not exactly the most comforting places.
Yeah. Yeah.
And yeah, like you just said it, something positive, something humorous at the end, and your message in between, or your message kind of filtered in somewhere,
Yeah.
they might listen and
No,
it
I
might sink. And I
agree.
think it works.
But I think it's harder for you guys because any sort of advice that you have to give or warn someone about, you're a doctor, right? So there's almost like you have to be almost more professional than me, right? In a way, it's like
In
there's not
delivery.
in delivery.
Yeah.
Whereas I'll be honest, I've had a lot of clients that have come to me that have had eating disorders
Okay.
and this and that. Technically, I should I shouldn't be giving advice
Mm.
about, as in I shouldn't be giving advice
About a medical condition.
about a medical condition. All right. So I'm very careful with what I say and how I say it. So with someone that has like an eating disorder or say a mental health situation, the way I deliver something is almost like it's not a big deal.
Mm.
And it's happened so many times where that person has felt so much better and I've helped them overcome that situation and be a lot happier and overcome an eating disorder. Now, and I'm no doctor. And again, a lot of PTs will say, no, no, I can't talk about that. I can't do
Yeah.
that. You need to go see a nutritionist. You need to go see a doctor for this and doctor for that. And I'm like, in my head, I would be like, what would I have done? What would we have done 150 years ago or something, or when no one has access to any of this? I feel like there's so much advice and so many people to go to with every little fucking thing. Everyone is scared to just like help when you know you can.
Mm.
Because at the end of the day, don't most people just want to be seen, loved, and heard? And when you do that, I feel like everyone already kind of has the answers. Would you agree?
Yes, to an extent.
Okay.
There comes a point with medical conditions where the person who is not the trained person can give the advice, not knowing what they don't know and not having the full picture. And they might be able to steer the way person into not a worse territory, but in a territory which is not helping them.
Mm,
And that
okay.
person might not know if they're not experiencing that condition. But I hear you in that certain conditions, especially the mental health ones, I'm not sure modern medicine understands mental health. And the psychiatrists and psychologists I speak to largely agree. There's a lot of medication happening. Um, and I'm not sure that's actually solving the root cause of it.
Yeah, 100%.
Medications are, pharmacokinetically, it's just handling one thing in your brain. I'm not sure we understand the complexity of this enough. So that's one aspect I would just caution people on. It's a hard line to take because as a personal trainer, you're seeing you're seeing eating disorders, mental health, you're seeing obesity, right? Probably in a high volume.
Yeah.
That is a medical condition, but you are treating it, are you not?
Y
By providing advice, guidance, programs. Where does the line where does the line go? Because are medics treating obesity? Medicine will give advice on diets, and they have lots of information guides out there through the National Health Service. And we know about gastric bypass, which is for the more severe cases.
Yeah.
That's quite further
Yeah, yeah, yeah.
down the field. But on a level of calorie intake versus
Yeah.
output and all the things you know about, is that serving the person, and making them healthier? Probably. So I'm in full support of that.
Yeah. I'll be honest, I've spoken to a lot of doctors, um, and there's definitely a lot that do not know how to give advice on how someone should look after their diet or their cells with very basic principles or things to do to be healthier and better. Because a lot of people do go to the GP when they have this problem. I still get people coming up to me going, Darren, I spoke to a doctor at the NHS and they told me to cut out carbs completely. And
Yeah.
I'm like, oh, fuck, that's so bad. That's so bad. But I guess I feel like people just need to be smart with who they pick to get advice from.
Do you think it's super hard to find good advice in terms of how does anyone know what is a good advisor when it comes to fitness,
Okay,
dental,
this is
medical, hair,
okay.
skin,
Yeah,
beauty, makeup?
yeah.
Because you look at your feed right
Oh,
now, you'll
mate.
see you'll have a million people on all the platforms
Yeah,
telling you that they're an expert, and they'll have a great following. They'll have a blue tick. They'll have all this
yeah,
stuff, right? Credentials which seem legit.
yeah,
We're getting bombarded with stuff when it comes to diet.
yes.
Should we be eating less carbs, more carbs, fats and protein contents being changed all the
Yeah.
time?
Or brushing your teeth twice a day or one a day or what? Like,
Even
right?
that, right?
All
Yeah.
of that.
People will say to me in response to this that the things I've said are
Yeah,
potentially incorrect.
yeah,
I mean, I would argue they're not. And I've had those conversations with dentists, and largely I think people have come around when it comes to some of the things I've noted. But
yeah,
coming back to diets, it's super hard to figure out what is good information because there's no evidence base.
yeah.
People just having an opinion saying it worked for me. How do you reconcile that as a professional?
Honestly, I think humanity, yeah, people are becoming lazier and lazier,
Mm,
right? They're becoming so lazy. And I'm not talking about being lazy with the actions that they need to take to be healthy and blah, blah, blah. I'm talking about people are becoming lazy with looking at someone and really looking into them, to how they are, how they sit, how they talk, what their energy is like, to know if they're trustworthy or not. Back in the day, there was none of these blue ticks this, qualification that,
mm,
qualification this. There was none of that. People would rely on that instinct, their gut instinct.
yeah.
But now people don't rely on any of that. I would like, and I've got in trouble for this with my friends and stuff. And we'll meet someone outside or at an event or something. And I'd be like, I don't trust that fucking person, bro. I'm not engaging with that individual. I'm sorry. They're like, you can't say that. He's done nothing wrong. I'm like,
Mm.
okay, I understand that. But like, I just know that I don't get a good feeling about that person. I don't trust that person. I would not take advice of him or her. And I wouldn't trust anything that comes out of their mouth from a few actions that they've done.
Is this coming back to body language, or is this based on something all of it?
All of
Okay.
the whole shebang. Like
Yeah.
I would trust you, not because you're qualified. I would
Mm.
trust you because you seem genuine to me.
Okay.
You seem like you are, you know who you are, you know what you do, and you seem confident in the way you speak about certain things. I would look at those things and go,
Mm.
I'm going to trust his advice.
S
Not going to trust, no offense, how qualified you are. Of course, if you're operating on me, then I would look into that. But like, I'm going to look into that and go, he's legit. Do you get what I mean?
That's interesting because, yeah, you've taken it down to kind of a, bare bones primal view of what vibe are you getting from this person
Yeah.
on a instinctual, non-verbal level, kind of,
Yes.
right? And as society has gone on, we've almost valued that less in favor of, which is what you're
Yes.
saying,
Yeah.
of credentials on paper, qualifications, blue ticks, followings, that stamp of approval.
Yeah.
I mean, that latter group of things are not kind of irrelevant. I just think how does an individual who is not an expert in these fields come up with how do they reconcile those two groups of things? You'd say go more on the primal, like instinct type stuff, right?
I think so.
I think it makes sense. Can you ascertain that from a video on social media?
I
Tough.
think it's tough
Yeah.
because some people are great artists.
Yeah.
They're great. They're
Well, great on
great.
camera.
Great
Great.
on
They
camera.
have a character,
They have a character. They're
right?
great on character. But if you look at a lot of their videos, you will find something.
Yeah.
Like, for
Mm.
example, when I go to a mechanic, I don't know what the fuck I'm talking about. I'm not a mechanic. If he says your gearbox is messed up, I can't really argue against it.
Okay.
But I can pick up something where I'm like, okay, all right, bro, I appreciate you. And I'm not going to do that with him there. I'm going to go somewhere else. Do you get what I mean? You can find something. You can pick up. They might whisper something to the guy next to you. They might say, "Oh, look, this opportunity to make a bit of cash or something."
Mm.
Which is why I've always trusted that primal instinct, and it's done. And it's protected me a lot.
Mm. You're showing a high level of EQ,
Yeah,
right? You
yeah,
probably had that to you before.
yeah,
You're showing a lot of social intelligence.
yeah,
You can take a social situation and figure out the characters pretty quickly.
yeah, 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 yeah.
You'll be on the back foot and make assumption. Well, yeah, make extrapolations based on what you're seeing,
I'll assess a room first.
which is a skill. It's a
Yeah,
skill, and you've picked it up. It seems naturally.
yeah,
Some people try and teach it, which
yes.
I don't know if that's possible,
I
but
don't know if it's
I'm not
possible
sure if
either.
it's a teachable thing. Um,
It's experience, I think.
I don't think everyone has that, or what you have. I don't think
Maybe.
people can articulate it either. I think everyone has it to a degree. I think some people will lack or they'll be either mistrusting or completely just, well, you call it gullible.
Yeah.
And that mechanic would say what they say, and the person doesn't know about mechanics, doesn't catch any of those cues you mentioned, they'd proceed. And the same thing can apply to skin, hair, beauty, makeup.
Yes.
Good thing about kind of some of those groups is that a lot of it is kind of reversible.
Yeah.
It's
Yeah.
not going to cause long term damage. The concern would come with things that are irreversible.
Like a lot of we won't get into this, the transgender stuff, but
Yeah.
there's a lot of stuff that's been talking about where doctors are giving out, um, like young kids talking about young kids about changing genders and stuff, and
Mm,
then operating and doing stuff that's irreversible, right? Whereas, which is why I guess, of course, because everyone doesn't have that skill or whatnot, having those credentials is obviously good.
yeah.
But I feel like people in general should look more into what an individual does to trust them, to
Mm,
give their money to that person. Why would I give you my money? My friend, you looked after my friend. He has said good words about you. I've looked into what you do and I trust you as a person. So if I was to get my teeth done, I'd probably come to you instead of just going blue tick,
mm.
only wears Essex, I'll buy.
Yeah, which is the lazy way,
It's just the lazy way.
right?
That's what I mean by people
Yeah.
being lazy and
Mm.
not actually just have a look at what this person does before you buy into, I guess, anything, you know? And it's that's a tough conversation because like you said, I can't really prove any of that.
No, it's interesting what you said about, the laziness and, people are probably going for that, short distance from researching something to transacting or going ahead with a procedure in a very short space of time, not doing that social sort of analysis that you just described. And it reminds me of a conversation I've had with several uh, lay people, patients in the past who have gone to Turkey to have their teeth done. And I explained the things that we talked about the last one, and they kind of almost changed my mind about, just made me think differently
Mm.
in that they accept that they will likely lose their teeth by the time they're 40. And that's okay with them. They understand. But what's unacceptable to them at this stage in life is, or for some of these people, is having a set of teeth they're unhappy with and not being able to afford to change that.
Mm.
If the teeth don't function by the time they're middle aged, they've accepted that outcome. Now, I know I see
Mm.
you're scowling a bit there, and I was internally when I heard this, and it goes against what we get taught in medical school, which is function first, cosmetics after.
Okay.
If the teeth don't have a good foundation and health, you can make them look as good as you like, but everything will fail,
Mm.
and that makes sense. This turns that on its head. Some people are looking at it in the other way. If they're not happy with the way things look, all is lost. Doesn't matter if they
Mm.
function.
Yeah.
And it's a very alternative way of thinking about things, but it's made me soften my approach because people really have taken this, i- you know, this method of placing crowns on teeth in a quite an aggressive way to make things look better in a way that's a lot cheaper than what happens in the UK. I'm not saying I accept it,
Yeah.
but I respect the opinion of someone else who's done their research. They've seen what the cost is here, they've seen what the cost is there, and they can see the risks. I mean, many of them can't. They haven't done that research, but
Yeah.
I've spoken to a few who have, and they've made a conscious decision to prioritize the aesthetics whilst they're in this young stage of their life. They're living your best life now, right? Which is
Yeah.
a generational thing, and tackling the problems, albeit severe,
Mm.
later in life. Many people might say, well, they don't know what they don't know. There's a
Mm.
big implication of pain, cost, uncomfortability. How can they make such a decision at such a young age? I can't comment on that.
Mm.
I'm not the clinician treating them. I haven't done that assessment on, their maturity, but just a brief conversation with some of these people, it's made me think since, since so many dentists in the UK are going after or just completely slating overseas dentistry, some of it's driven by the clients.
Yeah. Okay. Makes sense. Question: Why people are going there because it's cheaper?
Yeah.
What's the really expensive thing?
How do you mean?
As in, when you're getting your teeth done,
Mm.
is it the hours you put in, or is it getting something made? What is the most expensive? Why is it cost so much more here?
The most expensive part of the process will be the combination of the person doing the treatment, the time of that person, and the training they've gone through to be able to perform that procedure to a standard, combined with the operating costs of a dental clinic in the UK, which will be higher than some of these countries, such as Turkey, Thailand, Poland, Romania. Those are the common ones.
People doing it in Thailand as well.
A lot in Thailand, yeah,
Really?
yeah, a lot of stuff we see from Thailand. Romania and used to be Ukraine, not so much anymore.
Mm. Yeah.
Ukraine and yeah, Romania. That's the most expensive part. Now, the time involved for veneers as opposed to crowns is much higher. The clinical skill involved is higher because the way they are fixed onto the teeth is different. We may have talked about it last
Yeah.
time.
Yeah.
Crown goes all the way around the tooth. A veneer sits on the outside.
Okay. Yeah.
With a crown, it's not as critical how you actually fix it onto the teeth because it's mechanically locked onto the tooth. A
Okay.
veneer is not. It's only holding on by your adhesive method and your technique, which needs to be precise.
So it can just pop out.
If you don't do it correctly, yeah.
Really?
Mm.
What's the worst thing you've seen happen with someone getting like their veneers done? Has anyone come up to you with like had like a severe issue after they've gone away and done it abroad or something?
Yeah, yeah,
You've had a
we
lot?
see quite a lot. Yeah.
What's like what happens, for example? What's a bad thing that happens?
A bad one is the nerve inside the tooth dies and gets infected, and you
Okay.
get kind of a swelling on your mouth, and if you leave it there, your face,
Oh shit.
and
Okay.
if you leave it there for long enough, you'll end up in A&E with someone needing to drain it for you, and the tooth needs to be removed, and that's the most severe outcome in terms of kind of medical complication.
Oh really? Okay.
That's not a good one. And there have been kind of well documented cases of people coming back with infections. That's a bad one. The other one is teeth just falling out and it's your front teeth, and it's pretty hard to go about your day and your work if you don't have front teeth.
Okay. Yeah. Of course.
But worst outcome overall is someone went abroad and they had all their teeth removed in favor of implants.
Yeah.
So it's not a crown. The entire tooth is removed, and you place an implant and place all the teeth onto several implants.
Oh shit. Okay.
Yeah. So you've lost the tooth entirely, and not one, all of them. Patient came back to the UK, had raging gum disease around the implants, and she had it before she went out on her teeth anyway. Out of the, I think, 16 implants, two of them survived. They had two implants left. She was left without teeth and just had a denture.
No teeth.
Yeah. So that was the worst we had. She arrived with no teeth and a very loose, ill-fitting denture. That's a tough one.
Could you help her out? You sorted it out?
Yeah. The plan is complex, takes a bit of time, but yeah, there's a solution. But it's about as bad as it gets.
Oh man, that'd be scary looking into the mirror with no teeth.
In sympathy to her, she made a bad choice, but I've got some sympathy for someone who's had such a poor outcome from something they just, had faith in someone to
Mm,
do
of
a
course.
good job and it's turned out so badly because the road to recovery is so comprehensive and invasive,
Okay,
which could
yeah.
have been avoided just by saving the natural teeth in some way. That's why uh, to get a cosmetic outcome is fine. We all want teeth to look good. For yourself, you've had good teeth, and your teeth have always looked good. So it's
Yeah.
probably a mindset you may have not really kind of directly empathized with, but you can do it in a way that makes sure your teeth last your entire life.
Okay.
By the time you get to implants are never going to be as good as natural teeth.
Mm,
So if you jump straight to the most aggressive option first,
then
you're
got
only
you.
going to have a long road um, to maintain that because dentistry is imperfect. Nature got it better than we did.
Mm. What could I get done to my teeth? Out of curiosity, I've never like what makes it. Do people get whitened or something?
Well,
Or
you could have lots done to your teeth, as we just described.
yeah. No, but as in like,
But
say someone like me, I've got healthy teeth, but I want to spice things up a little bit. What does one do to have better teeth?
well, we normally start with what don't you like about your teeth. If the answer is nothing, do nothing.
Okay, well there you go.
There you go.
Okay,
But
perfect.
if I would suggest something for someone who's got pretty good teeth, hasn't had much done to their teeth, whitening them is a good idea.
Okay,
Getting them a bit brighter, cleaner. You're doing the cleaning already.
yeah,
Um, we do use tooth contouring quite a lot, which is where you take teeth that are slightly uneven, chipped, asymmetric, and you
yeah,
even them out, make them smoother, neater by just reshaping them. You don't add anything to the teeth. It's quite a good minimalist way to make things better without
really.
having something comprehensive like veneers, crowns, composite bonding, implants, because it can be done in one appointment. You don't even need to be anesthetized for it, and you can combine it with whitening, and we do that quite a lot for young people, and it helps.
Mad. Okay. Does also does your teeth like from a young age? Okay, let's see if I can ask this properly. It might be complex to answer as well. Does what I eat and how I eat dictate the shape of my teeth? Like, there was a study showing like recently our jawlines are like our jaws are changing from our diet and whatnot. I'm a big meat eater, innit? I even chew on
Yeah.
the bones, bruv. I'm not gonna lie.
Okay.
I eat like I eat the whole chicken wing.
You eat
When
the
I'm having
bones. Eat,
like
oh, you
I,
eat the bones.
I when I'm having wings, I mash it up and I eat the bone marrow
Oh
and
right. So
yeah,
the whole bone gets eaten.
yeah, majority of the time, yeah, I just like chop it up and I eat it.
Okay.
People usually think I'm a crackhead for it, but I'm like, no, I like the bone marrow. I like sucking on it.
They say the bone marrow is very good for you.
Yeah, that's why I do it.
You probably get your entire iron complement in the entire
Maybe,
year
yeah,
in one marrow
maybe.
because it's just high rich in like red blood cells. It's
Exactly. So
very
I
good for
just
you.
I just yam on that, and I'm like, and someone told me the other day, Darren, you got like fangs on your teeth, and I'm like, I wonder if that's got anything to do with me eating loads of shit or just genetics, because my mom and dad don't have. So does your diet and how you eat from a young age dictate the shape of your jaw?
So the teeth themselves are going to be set in their shape. They're not going to change. They're only
Okay.
going to change in a way of tooth wear, meaning if you keep biting really hard things on one tooth, it might wear down and get a
Okay.
bit flatter. But as time gone on, of course, we're evolving as humans, and you've probably heard of wisdom teeth.
Yeah.
They're kind of these kind of ancillary appendix type teeth that we don't particularly need, but they're from an age when we used to have a much more herbivore type diet. We're eating a lot more kind of rough type foods,
Yeah.
and we needed more teeth on the back. So we had wisdom teeth. Now our faces are less Neanderthal, they're shallower, so we don't have the space for those wisdom teeth, yet those wisdom teeth keeps coming through, which is why we get issues and we need to have them removed.
Oh shit.
That's the history behind it. So as time is going on, our faces are getting shorter in depth. Why that's happening is probably because we're no
Soft.
we're softer and our diets are getting softer. What do you see on a menu? It's all tender meat type foods, right?
Right.
Fillet
Yeah.
steak type stuff. And it's interesting because the movement against meat more into vegan food is almost putting that on its head because vegan diets are probably going to have more fiber in them. More fibrous foods
Okay.
is kind of working against that. So you're right. You got canines there, the pointy teeth.
Yeah.
They're classically designed for cutting into meats.
Sick.
So developed specifically for that, which is actually a physiological adaptation to say that we ate meat in the past,
Yeah.
we eat it today, and yes, we don't particularly need to eat it, but we are designed for it.
Sick. So I'm gonna continue that shit. So my kids can at least have a good jawline or something. I don't know.
Yeah.
Maybe.
And the thing is, as time goes on, we're seeing more people who don't have straight teeth, right? And people ask, "Oh, why is that happening?" Probably because our diets are getting softer and softer. We're
Mm,
not having that normal feedback to the ligaments in our teeth when you're
yeah.
eating tough foods. So I would actually say the diet you described of the chicken wings and the bones is probably more naturalistic and
Mm,
uh, according to how we've developed. I mean,
okay.
no one's doing that these days
Yeah,
except for
yeah.
you, but I would actually say it's probably good for you
Okay. Yeah, yeah, yeah.
in
Got
terms
you.
of your bone, muscle, and ligament health.
Got you.
It's
Got you. Got
more
you.
towards what we're designed to do. You watch a dog eat a bone, they'll do it in a similar way,
Yeah.
right? Not to make the comparison to you and the
I don't
dog.
care, bruv.
I didn't mean it that
I'd rather
way.
be a dog than be soft.
But I mean it in a positive way in that dogs don't have this kind of modern society approach to things. They will
Yeah.
eat their food how they want to,
Yeah.
and their approach is why uh, their teeth are not crooked ever, are
Well,
they?
oh no, they're
Have you
not.
ever seen a dog with braces?
No.
I actually have seen a dog with braces.
Have you?
I have.
Probably in Fulham or something.
Yeah.
Was it?
Yeah,
Yeah.
but they tend to have very straight teeth.
Yeah, fair enough, fair enough.
Yeah, we're all having Invisalign, aren't
Yeah,
we?
it's weird that you say that about the mouth and the teeth. It's like not only is like the teeth and the face you're saying is getting shorter and more shallow. That's what you said, right?
Yeah.
Yeah,
Not in width,
yeah, yeah.
in depth.
In depth,
Yeah,
okay.
so kind of front to back.
And like
Yeah.
it's the same happening with our bodies. We're actually becoming sloppier and softer.
In
'Cause,
terms of?
like our bodies in general, like sloppy, as in because we don't have to be as physical
Yeah,
as
anymore.
we anymore.
Mm.
So it's like it's the same thing, and it's weird. It's just like we just become a bit.
Probably
It's
more injuries, right?
yeah, more, way
Yeah,
more.
yeah.
That's why if people don't train and actually do things that are tough, you're gonna like suffer for it later on. If not you, your bloodline is.
Mm.
Like your bloodline's gonna suffer and become sounds really animalistic, but like a weak species. Like, do you know what I mean?
But it's interesting you say that. As a species, we are over the hill in terms of ev evolutionary progression. We're not progressing better.
No, yeah,
We're getting
exactly.
worse.
We're getting worse. Yeah,
Probably our best time is when we were hunter-gatherers needing to actually fight and survive to get food because it relied on us being fast, having, lack of injuries, being strong.
being strong.
These days, being strong and fit doesn't serve you other than in the aesthetic way.
100%. 100%.
So why do it?
I know.
So
Yeah,
which is not the right way of thinking. I would say it's my opinion, but it's a societal change.
it is.
How
It
do you
is.
work against that? I mean, you are working against it, aren't you,
I'm,
with
tr-
your work?
I'm trying. Yeah, I'm trying. It's weird, isn't it? The more I don't know about you, but like, are you still enjoying the city? Like, do you enjoy being in London? Do you really like it?
I like London.
Have you
I
gone out into the nature? Are you going out spending more time in nature at all or anything like that?
I try to as much as I can, but every time I've been on a expedition or a trip, extended time in nature, it almost cures you of
Everything.
any sort of worry or
Right.
uh, trivial concern you've got.
Right. Yeah.
Everyone seems to level with you. Something about being, I don't know, nature or in a extreme environment where we're outside and kind of you're boiled down to your basic needs and necessities of just food, water, shelter, that sort of thing. all ego
It's gone.
is gone. Doesn't matter what you've done
Doesn't matter what you've
or
done.
what you're worth.
You're tiny.
Yeah, everyone's kind of the same, and
You're the
really everyone
same.
starts to become pretty
And you
nice
need
and
each other to
yeah,
survive.
yeah,
It's the best thing about camping and going
exactly.
hiking and stuff.
Yeah,
You
yeah.
need each other.
That's exactly what I was referring to. Mountaineering, where you are camping out and you're living with people and you're relying on each other to stay alive. People become very kind and helpful. What else can you be?
Exactly.
But in
Exactly.
modern society, you have all these complex interactions which we've sort of made up as a species, and it kind of I don't know. Is it good for us? What do you say?
No,
Probably not.
it's fucking shit. Everyone's full of shit. Everyone beats around the bush. And then when you're straightforward about something, someone goes, "What are you being aggressive
Yeah.
for?" Oh, what? Now you're a fucking victim. You've asked me what I think, and I've told you what I thought,
Yeah.
and now you're playing it's crazy. You can't like, and it makes people like. I'm not gonna lie, it does make me angry sometimes, and it sounds weird, but like I live in like SW area now, and I'm
Yeah.
like, it's a nice area, but I'm not gonna lie, I sometimes miss like Tottenham, Hackney,
Yeah.
those areas. It sounds weird, but those areas are a lot more like, what are you looking at, man? Nothing, man. Sorry, I just look like everyone.
Up front, and I kind of
They're just
exactly what
exactly,
they're saying is what they look
yeah.
like.
There's no bullshit.
Yeah.
It's like, hey, how are you? How was work? Like you don't really care, so don't ask me. Just say hello, peace, walk past me, innit? All good. Whereas everyone
Mm.
watching this is gonna say like, fucking hell, Darren's angry, innit? But I'm not. I'm just like, I just can't stand people. I just can't stand things that are not. I'm just sick of people not being genuine.
Genuine. Yeah.
And
Ingenuity. Yeah.
it's sad because I don't think people realize if that carries on for a long period of time, and if you influence people around you with that fake bullshit, it creates a bad society and a bad community around you. Do you know what I
We're
mean?
already there, though, right?
We are, but it
Yeah.
would get worse if it's
Mm.
not addressed.
How do we address it? Oh, it's
People
tough.
just need to like,
Take a bit of time out.
people just need to be, and it sounds mad, but like, this is why I'm self-employed. This is why I'd run my own business, and I would like. I'm just trying to think of like
I can't imagine you as an employee.
I'm
It
just
would
trying to
it would
imagine,
kick
yeah.
off.
No, no, it would be done. I'd be at HR every day.
Yeah.
I'd be at HR every day. Like I hear stories from my friends of like this thing happened in the office, and I'm like, well, go tell that person that they can't do that. They're like, you can't because then it's against this and this. I'm like, oh my god, this is crazy. Like it's mad. Yeah, yeah. I don't know. That's a whole nother fucking conversation. That's a
It's super tough, and I've spoken to other people who, from similar parts of London who feel the same way, but you kind of have to toe the line and kind of if you wanna function in the society, if you go against it too much, you almost become like an outsider,
you do.
a
Then
black
no,
sheep.
people get threatened.
Yeah. Or the aggressive line gets thrown your way, which is, oh, they're disagreeable or argumentative. All these ones have been thrown my way in the past. I'd admit that actually I've towed the line as well,
Yeah,
especially for the profession I'm in. There's a certain approach which is expected to come across as professional.
yeah,
And the term professional, I don't know if it gets bounded around in the fitness industry much, but in medical and dental, it does.
yeah.
And it's a terminology to describe uh, what the profession expect, expects of you in terms of
Mm,
behavior. But that changes with time, right?
again,
Like we said at the
exactly.
beginning. And to an extent, we are regulated people and we have to oblige, we have to follow that to a degree.
Yeah,
But it doesn't mean we can't be honest and say what we think about it in
yeah,
terms of a society based approach. But the great thing about the fitness industry is it's not regulated,
yeah.
right? Is that true? Is there anyone who someone can go to as an ombudsman or
There is like where you get qualified for a PT and stuff. But if I'm being honest, if you run your own business, then I've there's been a lot of situations where probably should have been in trouble,
okay,
maybe,
sure.
and not I've never got in.
So it's really only British law and
Yeah,
Companies House.
yeah,
That's it.
yeah, yeah. Pretty
Trading
much,
standards.
pretty much, or
Okay.
getting called out.
Okay. On social proof
Yeah, I
type
guess
stuff.
so. Yeah,
Okay.
yeah, yeah.
Yeah.
Really, that's it. Really,
But I guess that can work in your favor or not, right?
correct.
Bit like Liver King.
Yes, exactly like that.
Yeah.
Exactly like that. Which is why, again, it's just need to be open about it all. Everything that you do, whoever you are. And then you got like when you got nothing to hide, you can just be yourself.
Mm,
No one can bring you down. Do you know what I mean? When someone like says something about you that you're already very open about,
mm.
you're like, well, yeah, I know that. So that's not, I've,
Well, it disarms the person pretty quickly.
yeah, it's
Yeah.
just like, yeah,
Mm.
and what else is new, mate? I mean,
I feel like you've had an experience of that. That
I've had loads of experiences like that, man. I've
yeah.
had loads of, with everything. Someone would say something, I'm like, yeah, sweet. That's pretty obvious that I don't care about your opinion
Right.
or something like that. You know, and I think, and it's weird. I think as I'm getting older, I'm becoming less like I can't, if I'm just like completely done with, if I don't want to be somewhere, I'm not going to be there. Put
Right.
it like that.
Yeah.
I'm not, I don't really care about the whole polite thing anymore. I don't think there's enough time to be polite to something or someone where it creates negative space for you.
It's interesting because I feel the same way about that's not going somewhere you don't want to be. But then I get the opposition to me, and I kind of listen, which is, what if it was important for that other person for you being there, like a family member said it was really important, Darren, I want you to be at this event.
Yeah.
It would mean a lot to me,
Yeah.
even though you don't want to be there. Would you consider it?
If it's a family member, a friend, that are important people in my life, 100%, I will do that
Okay.
for them. I wouldn't question it because I know they will do the same for me.
Okay.
But when it's people where it's just completely out of the blue
Mm.
and then it does nothing for you, then there's no point.
Yeah.
I don't think there's any point.
Yeah.
Do you know what I mean? But yeah, that's a whole, we can keep going. We've run out of time.
Have we?
We've run out of time.
Okay.
We've run out of time. But we'll have to have you on again, bruv. It's a nice conversation.
It was good.
I should get like, I've had a lot of doctors on actually.
Have
I
you?
should get like
A round table.
5 round table of doctors.
We'll just start attacking each other.
Attack
That'd
each
be
other.
great.
Yeah,
That'd be
that'd be
awesome.
great. That'd be
awesome.
cool.
Yeah.
Good chat.
Who's that guy? The guy that James got after me? What's his name? The TikTok man, the doctor.
Dr. Curran.
The one who, yeah.
Dr. Curran. I had him a few weeks ago as
He's
well.
good, right?
Oh, mate, he's good.
He's a
lad.
good guy.
You'd like him.
Yeah, he seems like a great guy. I like his videos.
He's good. He's
Yeah,
good.
yeah.
Really good. He's good fun. He's good chat as well.
Yeah,
He's good
he
chat
just, he
as
just throws he's doing kind of a similar thing, just kind of answering like common questions in medicine, like weird and wonderful stuff,
well.
and,
Yeah, I know.
and giving like a fun answer.
He's so smart, bruv. It's
Yeah.
scary. It's
Yeah.
scary. But where can people find you for the ones that don't know? What your socials?
Instagram, Dr. Sahil Patel, and on TikTok, Dr. Sahil. That's spelt Doctor the long way. LinkedIn, Facebook, and we're also on Snapchat as a clinic.
Oh, snap. There you, your clinic is in...
It's in London's Harley Street Medical District. It's a concentration of dental practices in London. If you haven't heard of it, you may have been
Yeah, I
there.
have, yeah.
Lots of doctors and dentists in one small area. And
But you're the best one.
well, I'd say there are lots of good ones. And ours is called Marylebone Smile Clinic. And yeah, we're focused on cosmetic and aesthetic treatments,
And smiling.
reconstruction, that sort of stuff. Yeah.
Yes. You walk in with a frown, you walk out
You've
with
not
a
been,
smile.
you've not come to the new clinic, have you?
No.
No, you haven't. You need to come along at some
Might come
point.
to whiten my teeth.
Well, the thing is, James is planning to come back. So maybe when he's back
Yeah.
in town.
He's always nagging me. He's like, bro, go get something to your teeth. I'm happy with my teeth, bro. I'm like, I'm happy with my teeth.
I think because of the Bali dentist you saw, that experience you had, he had that experience when he came to see me, I think.
Oh, maybe. Yes, he did. Yeah.
And as a result, he was so much more aware.
Oh yeah. He's way
So he's
more
on your
aware.
case now.
He's
That's
on
right.
my case. He's on my case. He's
Yeah.
on my case.
But you've got good teeth. It's you haven't had that bad genetics or dental trauma as a child. It's really common. Someone gets their teeth knocked when they're playing hockey or football,
Oh shit. Yeah. Okay.
and then it's just a lifetime of dentistry. I mean, it happens a lot, and I don't mean to put a downer on it because it could happen to any of us, but
yeah.
it is a lot of dentistry to sign up for just from when you get
Just
the
from
knock,
one
because
little
it's your
knock.
front tooth and it needs to be good. And as time goes on, our requirements get higher as we go through life. So we see that a lot from patients who are in their mid to late 20s. They've had their childhood correction done by their local dentist.
Oh shit.
And then it just needs to be
Okay.
upgraded for something that's going to be kind of invisible and doesn't draw attention anymore.
So guys, after you listen to this episode, buy yourself a gum shield.
Absolutely, yeah, for sure.
Guys, thank you very much for listening. Please share and subscribe. Peace and love. Take it easy.
Thanks
Boom.
very much, Darren.
Anytime, brother. Anytime.